Good afternoon, everyone. Can you hear me out there? Now you can hear me. Good afternoon. If you will close that door, I'd appreciate it very much. I want to thank you all so very much for being with us today. We're all here to discuss a very important issue that is of real concern to many communities across the country, and that is the issue of homelessness. We have an outstanding panel here with us today who collectively have over 90 years of experience advocating for programs that fight injustice and inequality for the most vulnerable populations in this country and across the world. So before I begin our program, I would like to recognize some people who are here with us today. Let me just mention Oren Moverman, director of Time Out of Mind, the movie that Mr. Richard Gere stars in. Would you identify yourself, Mr. Moverman? We have Bob Broussard, president of distribution, AMC Networks, producer and distributor of the movie. Would you please identify yourself, Mr. Broussard? We have Christine Bregan, vice president, AMC Networks, producer and distributor of the movie, Time Out of Mind. Please identify yourself. We have some other introductions we're going to make, but at this time, is Ms. Barbara Lee still in the room? Congresswoman Barbara Lee is here. Please stand. Congressman Cleaver is in the room. Please stand. And Congresswoman Beatty is in the room. Please stand. Thank you for coming. Ladies and gentlemen, the issue of homelessness in America is something that I have long been concerned about. Homelessness affects the very fabric of our communities, and it is a social issue as much as it is an economic issue. The effects of being homeless are harmful beyond what most of us can fathom, and they are often extremely difficult to reverse. Homelessness diminishes the dignity of human beings, and it degrades fundamental values on which our country is built. As a nation, we've made significant progress in recent years towards the goal of ending homelessness in our country, but this progress is uneven across the country, and it is at risk of stalling or backsliding without continued bipartisan support for funding federal homeless assistance and housing programs, along with the continued advocacy and service of nonprofits, government agencies, and activists on the ground. While homelessness overall has decreased in America, in my own city of Los Angeles, we have experienced a 16% increase in homelessness across the Los Angeles continuum of care from 2013 to 2015. The number of chronically homeless persons in the Los Angeles region also increased dramatically by 65% in just 2 years. And projections show that if we do not increase our federal, state, and local support for Los Angeles, the rate of chronic homelessness will increase by another 40% through 2017. These numbers are deeply concerning. But I remain hopeful, in large because of the commitment and resolve of homeless service providers, nonprofit organizations, advocates, and our administration, who all continue to work hard to house every single person they can with the resources they are allotted, to think creatively about how to stretch every dollar and to push to break down silos between the various levels of government. I recently visited a nonprofit organization in Los Angeles that is focused on providing chronically homeless women with permanent housing and supportive services that they need to stay housed. The women I spoke with were inspirational. One woman named Teresa opened up her home to us and spoke about the anguish and pain that being homeless caused her. She described that So many people feel that way in her situation, that homelessness can be cold and it can make people feel lost and unloved and disillusioned with themselves. But Teresa was lucky enough to get an apartment through the Downtown Women's Center in 2011, and that dramatically changed her life. We have to do more to make sure that all homeless people have the access to housing assistance, like Teresa. We have come together to educate each other about homelessness in our country. We have to have honest conversations about the challenges we face in working to end homelessness. And we have to stop making excuses for taking the steps that we already know will work. The federal government cannot turn a blind eye. Congress has a responsibility to the people of this country to provide everyone with a safe, decent, and affordable roof over their heads. And so, let's begin this dialogue with some of the top experts on this issue. First, we're very happy to have Matthew Doherty with us today. Matthew is Executive Director of the U.S. Interagency Council on Homelessness, the federal umbrella organization charged with organizing the administration's work to end homelessness. In that capacity, Matthew has spearheaded Opening Doors, the federal government's strategic plan to end homelessness. Opening Doors has brought 19 federal agencies and offices together, as well as state and local governments and communities, to help make ending homelessness an attainable goal that we can all work towards. Please welcome Matthew. Next, we have Jennifer Ho from the U.S. Department of Housing and Urban Development, who also joins us today. Jennifer is HUD Secretary Julian Castro's Senior Advisor on Housing and Services. Jennifer helps coordinate HUD's efforts to end homelessness with other government agencies. Jen also previously worked at the U.S. Interagency Council on Homelessness, helping to craft and begin implementation of the Opening Doors strategy. Would you please welcome her? We're also very happy to have Nan Roman, President and CEO of the National Alliance to End Homelessness, with us today. Nan has spent much of her career working on issues related to poverty and homelessness. As head of the National Alliance, Nan provides a leading voice to the challenges and issues facing America's homeless community on the local, state, and federal levels. Nan brings a world of experience, finding common sense solutions to the problems homelessness presents, partnering with government, nonprofits, and members of the community. And the last person that I'm going to introduce to you, I'm going to do it with such pride and such appreciation for who he is and for what he stands for. We are very, very honored to have him with us today. And I don't have to say his name. I just don't want you all to scream. We have Richard Gere with us today. You can scream if you want to. Most of you likely know Mr. Gere from the silver screen. However, in addition to his internationally renowned acting career, Richard has worked for over 30 years to draw attention to injustice, inequality, and intolerance around the world. Through the Gere Foundation, Richard has traveled the globe to promote human rights, dignity, and justice for people everywhere. So please, again, join me with a big round of a welcome for him and all of the panel. Allow me to just mention to the panel that two of the members of our committee is here today, focused on homelessness and inequality and disparities and all of that. Let me just make sure you know who they are. Ms. Beatty, would you please raise your hand again? Did we have another person in the back? But it was somebody in the back. Do we have someone in the back that's serving on our Financial Services Committee? Okay, so it's only been left. And Mr. Cleaver. Okay. Is he our ranking member? Yes. Mr. Cleaver is the ranking member on the Subcommittee on Housing. Please stand one more time. If we have other members who are in the back, we'd like them to please come up and on the front row. I thought I saw someone in the back there. Okay, thank you very much. Now, I would like for each of our panelists to give a brief introduction before we begin our moderated discussion. We will start with Matthew and move on to Jennifer, and then Nan, and then we'll have Richard conclude the introductions.
Great. Thank you, Congresswoman Waters. I really want to thank you for hosting this briefing today, but I especially want to thank you for being such a champion around these issues of homelessness for so long, and I know how important it is to you to make progress nationally and make progress in Los Angeles.
Thank you.
And we want to be your partner in that. I'm really honored to be here with all of you today, and especially to have this chance to speak with other distinguished members of Congress and the dedicated staff. Am I close enough to the microphone? Not quite. Okay. Okay, great. And I'm really honored to serve at USICH and work with our federal and our national and local partners as we seek to implement Opening Doors, which Congresswoman Waters did a great job of describing. Opening Doors, I think, has fundamentally changed the conversation about homelessness in the United States, changed it from a problem that we could talk about to a problem that we can solve. And it starts with a vision that no one should experience homelessness and no one should be without a safe, stable place to call home. And as I think as every one of us could imagine, a single night of homelessness is a crisis for any individual or family. But yet we have people who have been experiencing that crisis and that trauma for years or even decades on our streets. And that's a problem we need to solve, and we know how to solve. On any given night, there are almost 580,000 people estimated to be experiencing homelessness as of 2014. And each of those people is a different person with different challenges. Some are challenged with disabilities. Some have experienced a health crisis. Others may have experienced a job loss or survived domestic violence. Some people are struggling with addictions or have past involvement with the criminal justice system. We need to support communities' capacity to create pathways out of homelessness for that full diversity of people who are experiencing homelessness in our country, including people who have been without homes for a day, for a year, or for 10 years or longer. And that the solutions are different for different populations, but they're fundamentally informed by the same principles of how do we quickly link people to the permanent housing with the right level of services so that they can be stable and successful members of our communities again. To get to that goal in creating those pathways out of homelessness, locally, agencies and organizations are working in different ways. They're breaking down the silos across their agencies and programs, coordinating in new ways, and they're really increasingly focused on implementing the best and strongest practices. USICH's role at the federal level is to ensure that we're mirroring that breaking down of silos, and we're supporting communities to be able to integrate federal resources, policies, and practices in really coordinated ways. So a big part of our work is to bring the 19 member agencies together to set common vision for the strategies that we need to implement to ensure that all the federal programs and policies are working in concert together and are helping us to achieve the goals of Opening Doors. We do that work in a variety of ways. We have a policy team that helps bring the members of those agencies together and builds consensus around the vision and the strategies and the solutions that all of the federal agencies need to be supporting. We really work to make sure we're identifying areas in which there may be duplication of effort or fragmentation across the federal programs and find ways that we can be more efficient with the resources that we do have. And then we also make sure that we're ensuring that those resources are being used wisely and being invested into the strongest practices that are going to create the greatest outcomes. We can do a lot of that work to use existing resources more wisely. Los Angeles is doing terrific work with their federal resources and partnering with state and local resources. But it's not just about using the existing resources more wisely. We do need additional resources at the state, federal, and local levels. And we need investments into permanent supportive housing solutions for people experiencing chronic homelessness in our country. And the president's budget really calls for a significant investment in those resources to be able to create another 25,500 units of permanent supportive housing nationally to be able to help close the gap in communities that are struggling to have enough of that supply of housing. It's really critical that we bring those resources to bear, be able to deliver them to communities, have those communities use them aligned with the best practices, and we can start to turn the corner in even communities that are struggling to make progress today.
First, Congresswoman Waters, thank you so much for this hearing. Secretary Castro really appreciated being in Los Angeles with you and having an opportunity to see how homelessness manifests itself, but also meet with the nonprofits and some of the people who are being housed. He really appreciated that visit, so thank you for that. Mr. Gere, thank you for bringing your passion and your compassion to the screen and to the Congress to help us educate people about chronic homelessness, but also some of the solutions that we have available. And thank you to people who made time in the room today. I'm sure to come hear me and Matthew talk. Oh, man, of course. I knew that you were the star. I'd ask people in the room to just take a moment and think about the problems that you're working on right now, the problems that you're trying to solve. Just make a list. Now, only retain on that list those problems for which you know the solution. What it's going to take, how much it's going to take, what it's going to cost, and how it would be executed. That's where we are on solving and ending the problem of chronic homelessness in America. I'm guessing that there weren't a lot of other problems that leapt to mind that stayed on the list when you had to tick through the rest of the criteria. Matthew talked about 25,500 additional units of supportive housing if Congress were to invest $265 million additional dollars in HUD's homeless assistance grants. That would leverage state dollars, philanthropic dollars, tax credits. It would spur the creation of a sufficient supply of supportive housing, we think, to effectively end chronic homelessness in America. $265 million is the final investment that we would need to do this. And the thing that I think has become conventional wisdom is that if we don't, we're spending the money anyways, but we're spending the money to no good effect. We're spending the money on people's repeat use of jails. We're spending the money on people going to the emergency room over and over and over again, or ending up in the hospital. So it really has become conventional wisdom that it costs as much for somebody to remain on the street as it does for us to provide them a supportive housing. And I guess I want to reflect, too, and Congresswoman Waters, you would know this better than anyone, this used to be an issue that had bipartisan support year after year. In the previous administration, the Bush administration, hundreds of millions of dollars were invested year after year to create tens of thousands of additional units of supportive housing. And as a result, we have seen a 20% reduction in chronic homelessness across the country as a result of those investments in the creation of more supportive housing. And so at the very moment that communities are poised, that they have convinced themselves that somebody doesn't want to live on the street, they want a home, that if we can engage people and connect with them and offer them the thing that they need the most, a place to live, that this is actually a problem that's solvable. But at that very moment is when we seem to have lost our traction in terms of creating the federal investments that will make the difference. So it's terrific to be here today and to have an opportunity, I guess, really to highlight the fact that in the grand scheme of everything that we do, we don't have a lot of opportunities to solve a problem. And if you take the example of the extraordinary progress that we're making on veterans homelessness, this is where we have made those consistent investments in what works. And we're seeing the results across the country. We're seeing it in places like Houston and New Orleans, where they have effectively ended veterans homelessness. And we have an opportunity to do that with chronic homelessness. So I'm just thrilled to have had the opportunity to be up here with you today. I really appreciate the attention that we're bringing to this issue. Thank you.
Well, thank you so much. Glad to be here, and thank you so much, Mrs. Waters, for pulling this briefing together. The National Alliance to End Homelessness is an organization that uses evidence to discover what works best to end homelessness, and then works on to get better federal policy to support those solutions, and then to help communities implement those solutions. So that's what we do. Homelessness is certainly related to personal challenges that people have, like mental illness, poverty, and addiction to substances. But of course, as you know, the vast majority of people who have those kinds of problems are not homeless. They're housed. So mental illness and poverty and addiction alone are not the causes of homelessness. The fundamental cause of homelessness is that housing is just not affordable to many people who are poor. And for so many poor people, for them being able to keep themselves housed is no longer a given. And unfortunately, people who have mental and physical health issues are disproportionately poor and thus disproportionately homeless. And the reason we're talking about people who have disabilities and mental health and other kinds of problems is because of the film that sort of brings us a little bit here together today, Time Out of Mind, and the character that Mr. Gere plays in that film. And a great thing about that, I think, for those of you who haven't seen it, and I think most of us have not seen, and most of you have not seen it, but hopefully you'll get the opportunity to do that, is that it shows really the personal experience and tragedy that someone faces when they become homeless. It's really, as I'm sure you'll discuss, very much about someone's personal experience of it. People that are housed, people who have housing, still have a lot of problems. I'm sure all of us, many of us have a lot of problems. But and this is just my interpretation, but becomes disconnected from his family, from other people, and this contributes to his homelessness. So maybe being connected in that way doesn't really sound like a policy issue that I should be bringing up at an event like this, but many, many poor people, people who are poor, have difficulty paying for their housing. 2/3 of people who are poor pay more than half their incomes for rent, and since their rents or their incomes rather are so small, that leaves such a small amount of money, really insufficient amount of money to pay for everything else that they need, medicine, food, transportation, and so forth. But they network, they're connected, and they use those networks of friends, of relatives, of roommates, of associates to piece things together, very maybe to your abilities. Anybody become disagree what widespread prove any point. Specific thing, housing is who have before the appropriate important film
is what makes us human and makes us real and gives us the energy, that driving wheel to continue to get better, to succeed. So I think that's what we have to be looking for here with all the kind of technocrat answers of how to make a life look right and function correctly. But the software of belonging, of being precious, is something that we really have to offer in the mix of things, and maybe the most important thing.
Just a quick announcement. If you can get off of the house public Wi-Fi on your phones. Get off the public Wi-Fi on your phones, please. Thank you.
Hats, scarves, any unauthorized items, please. As soon as your stuff goes through the machine.
Before, but you really, it's, with chronic, I don't know. As Nan was saying, an experience of homeless people, self-resist, so that homelessness every day, that's actually homelessness. Problems that are buried. He has problems in combat, mental illness. Not that there's actually an 8 in there, a supportive.
There's a recent
kind of disabling. I would,
Our
point of view,